Hi, I am Dr. Vaibhav Deraje. I am a consultant craniofacial and plastic surgeon, Bangalore. Craniosynostosis is a condition where the growth plates of the skull fuse earlier than usual. For example, in a child's skull, there are multiple growth plates which help the skull to grow so as to allow the brain to grow. Now, when one of these or more of these sutures fuse before it has to fuse, that causes a condition called as craniosynostosis. Now, craniosynostosis can cause two things. Number one, because of the fusion, it can cause abnormal shaped head. There are different kinds of shape called brachycephaly, plagiocephaly, scaphocephaly, trigonocephaly that can be formed, which causes abnormal shaped head. The second thing that the craniosynostosis can cause is increase in the pressure in the brain. Now, when one of or more of these sutures fuse, what happens is the brain cannot grow because the skull is compressing it, and that can cause raised pressure in the brain. Now, these are the two things that can happen with craniosynostosis. Now, how do we diagnose craniosynostosis? The diagnosis of craniosynostosis is predominantly clinical in nature, where just by looking at the shape of the skull, we get an idea as to what has happened to the child. Now, along with that, we are also helped with X-rays of the skull, CT scans of the skull, MRI of the brain sometimes if needed, an ophthalmological examination to check the eyes, which will give us an idea whether the pressure in the brain is increased or not. Now, this is just generally how a craniosynostosis is diagnosed. Now, treatment is multiple options are available, ranging from minimally invasive endoscopic strip craniectomy with helmet therapy to the most radical surgery of total cranial vault remodeling.